everyone. Thank you for joining us today for the second of our 4 components of the 2021 CCLP Legislative Preview event. As I mentioned, this is the second of 4 short, bite-sized, half-hour pieces of this event that we've spread throughout the day, so you can schedule your busy day around this event. Hopefully, at this moment, you're joining us on your lunch break. And what more appropriate topic for your lunch break than food access and security? We're going to be joined today by 2 of my esteemed colleagues, our public benefits attorney, Sara Lipowitz, and our deputy director for research, Charlie Brennan. I'll hand it over to them in just a moment, but first I'm going to share some logistical details with you. First of all, as you join, if you like, please put your name and organization in the chat box, just as a hello and introduction. We can't do those in person, of course, in this format, but we'd love to hear from you in the chat there, so please put that in there if you like. Secondly, throughout the presentation, as you have questions that arise at any time, go ahead and put those in the Q&A box. You'll see that at the bottom of your screen, right just to the left of the chat box. So put your questions in the Q&A box at any time, and then we will get to as many questions as we possibly can at the end of the presentation. Okay, and if you missed our initial session at 9 a.m. or if you want to view this session again or share it with anybody, keep in mind that we are going to record and upload each of these segments to YouTube. So stay tuned to our YouTube channel and our social media, and we will let you know when that is ready to share. All right, and without further ado, I'm going to turn it over to our public benefits attorney here at CCLP, Sara Lipowitz. Sara, take it away. You're muted, Sara.
Of course. Okay, so this is Sara Lipowitz, public benefits attorney, and this is our presentation on food, and in particular, food insecurity during this pandemic period. And could we go to the next slide, please? So, food insecurity already was present in Colorado prior to COVID, and what we are going to be talking about in much of this presentation are the larger food benefit programs, the largest being Supplemental Nutrition Assistance Program, or SNAP, Women, Infants, and Children, otherwise known as WIC, another program that provides supplemental nutrition to pregnant women and their children up to age 5. And in Colorado, 70% of participating SNAP households have children in them, 30% have a disabled family member, and 46% have a working family member. So SNAP does cover many households in which there is a worker or more than one worker. It also covers and serves the needs of people who are not in the workforce, either because they are children or because they are experiencing disability or they are over the retirement age. Next slide. So one of our good partners, Hunger Free Colorado, did a survey and have been surveying the population during this period. They found that from September 15th to October 1st, their sample answered yes to the question of if they were facing food insecurity, up to 29%, which would be people who either said that they frequently had trouble obtaining enough nutritious food to eat, or sometimes had trouble obtaining enough nutritious food to eat. There have been some interplays between other public benefits programs and SNAP eligibility, such as unemployment benefits, and those have been sometimes the situation with unemployment benefits has been precarious. I think they have been extended up through the end of this year, but Charlie can correct me on that if I'm wrong. And we'll see what a new Congress might be willing to do for people who are facing longer term unemployment. So you're going to see in the data that Charlie presents, there's going to be some ups and downs to people enrolling and staying enrolled in programs, people experiencing food insecurity. we haven't broken it out, but I would suspect that these ups and downs do track to some degree to the ability of people to get unemployment or to find new employment. Also, our partners in the food insecurity landscape, such as application assisters and food pantries, saw a great increase in the demand for their services. They have stabilized to some degree, but they are still having to process at a higher rate than they were previously, and also are operating under new challenges, such as being able to socially distance and provide food or provide meals. Human services offices also have been struggling with those issues, having to enroll and keep people enrolled while still maintaining safety for their staff and for their clients. So there have been some responses that have helped with food insecurity, though I think, as you're going to see, we're still seeing food insecurity in the Colorado population to a higher degree than previously. But some of our relief packages, like Families First and the CARES Act, provided some financial assistance, some of which has been passed through directly. We at CCLP supported the Food Pantry Assistance Act grants, which came through the legislature in the previous session and then also in the special session. And that funneled more CARES Act money directly to our food banks and our food pantries. If you're not familiar with the distinction between the two, food banks are large regional distributors of food, and food pantries are smaller, more localized organizations in general. Individuals can be served by food banks, but they are also being served in a large degree by food pantries. They've seen their visits increase by 40% and sometimes more than that. In some of our benefits programs like WIC and SNAP and school lunches, the Department of Human Services applied for waivers of certain program requirements, which makes it easier for people to apply and to get enrolled and to stay enrolled in those programs. Also, there were some other smaller but important programs in the space, such as the FEMA Public Assistance Program, the USDA Farmers to Families, and Pandemic EBT, which is a way for families with children to get the value of school meals that they would have been provided if they were physically in school as a cash grant to them for the purchase of food. Oh, next slide, please. And so with that, I will let Charlie do a deep dive into some of the census data that he's found that's related to food insecurity.
Great, thanks, Sarah. That was a great overview of just sort of how programs in the state related to food security changed over the course of the year. There's one of the primary sources that we can turn to understand how food security changed over the course of the year for Colorado households or Coloradans is the Census Bureau's Household Pulse Survey. This was a survey product that was started at around May near the outset of the pandemic and was intended to be used to show sort of week-to-week changes in the population across a variety of topics, one of those being food. And so, there are some issues and drawbacks with this data source. It uses small sample sizes, so the margins of error tend to be large, particularly for subgroups. There's a lot of week-to-week variation in the data that makes it difficult to sort of discern trends or see sort of what's happening. And so, there are some drawbacks. However, I do think it's a useful tool or useful piece of data to be able to understand the trends and general movement that we've seen in some of these indicators over time. And so here you can see the share of Coloradans 18 and over who reported that they sometimes or often didn't have enough food to eat in the past 7 days. This is from the second phases, the last two phases of the Household Pulse Survey. And it does show that there has been an increase over, since the beginning of August or mid-August through the end of November in the rate of food insecurity among Coloradans. The shaded pink area, just to give you a sense, is the margin of error for this data statistic as reported by the Census Bureau. So you can see that there is, sort of a wide range of variation even within the values that were given as sort of being, at least the 90% confidence interval for this data. Oops, next slide. So when we look at, I think one of the things that was characterized this recession or the period post-COVID for many Coloradans has been job losses. And so when we look at the rate of food insecurity among Coloradans who don't have a job or reported not having a job to the census pulse survey, we can see that, over much of the summer, the rate was higher than Coloradans as a whole. And then troublingly, we can see, in the past couple of weeks of 2020, or at least leading up to November, we can see that there has been sort of a steady increase in the number of or share of Coloradans reporting them being food insecure and also not having a job. We can also see that the rates of food insecurity among SNAP clients or people who reported using SNAP to help them meet their spending needs over the past 7 days, week to week, is much higher than for the population as a whole, or even unemployed Coloradans. However, it has been trending downward in the past couple of weeks.
And I just wanted to add a little something here about the SNAP population, represented there by the squiggly yellow line. People who qualify for the program are at either 130% of the poverty level, or under certain circumstances, they can qualify up to 200% of the poverty level. But the SNAP benefit itself never covers all of the food needs of a SNAP household. I think studies have shown that they still spend more than 1/3 in addition, of the amount that they get in their grant, they spend more than 1/3 of that per month out of their own money. So it is common in SNAP households for the benefit to run out by the end of the month, and for the household to have to start skipping meals, conserving, rationing, cutting back. So even with the program, you see there's still a high degree of food insecurity in that population.
Great. No, thanks for that, Sarah. And I just wanted to add really quickly too, in case folks were wondering why there's a gap in the chart. So unfortunately, another one of the drawbacks of the pulse survey is that the census took about a 4-week break in the summer at the end of the first phase of the survey before restarting the survey again towards the middle of August. And so there's a bit of a 4-week period there where we don't actually have data for all of these statistics. So we kind of just have to guess in what happened in the middle, but that's why there's that gap. Next slide. And so, when we look at the rates of food insecurity among low-income Coloradans, we can see, as with the SNAP population in general, that the Coloradans that have household incomes of less than $35,000 do experience higher rates of food insecurity, and did over the course of the year. And when we look at the trends, the trend line, so that dotted line on the chart, we can see that the rate of food insecurity among that population has been increasing faster than the population as a whole. And generally, this is the population that would be eligible for SNAP based on their incomes. I think the cutoff for a family of 4 would be about $34,000. So this either indicates, as Sarah mentioned, that SNAP benefits aren't sufficient to help families cover their needs, or that there's a share of folks who might be eligible for SNAP but aren't aware and haven't applied for SNAP benefits yet. Next slide. And then finally, another a data point from the pulse surveys that we can look at is where folks got their food. And so the share of Coloradans who received free groceries or meals in the past 7 days, week to week, is shown on in the blue line. And as we can see, again, there was tremendous variation week to week. I think that probably largely reflects just the state of food insecurity for many families. Some weeks are better than others. And so it's really, again, this is an example of a data point that's even harder to sort of discern a trend. We can see, it's gone up and down, which, over time means that it's flat, but, we can see that in the past couple of weeks, it has been increasing. And also when we look specifically at Coloradans who received food from a food bank or food pantry, which is shown in the red on the chart, we can see that it's a much smaller share, but that the share has been increasing and trending upwards, particularly in the last couple of weeks of the year.
I forgot to mention previously that when we talk about people who qualify for public benefits programs, we are often talking about their income as a percentage of FPL, or the federal poverty level. The federal poverty level is one way of measuring poverty. It is not the only way of measuring poverty, and it has deficiencies as a way of measuring. So it assumes that you're spending, that the household budget requires a greater expenditure on food than it actually does in comparison to other costs that have risen for families a lot more steeply in the last, few decades, or whenever the FPL was generated. So they take the FPL, they take what they think you spend on food, and they times it times 2, and that is supposed to be your entire household budget to cover transportation, childcare, health care, and just your utilities, your rent, and a lot of those things, especially utilities, transportation, rent, childcare, healthcare, have increased a lot more rapidly than the cost of food. So when we're talking about people who are food insecure, we are talking about people who live below or at what the federal government might define as the poverty level, but there are a lot of people who are over that amount who are struggling. So next slide.
Yep. Great. And so another source of data about food insecurity over this period that we can look to is SNAP enrollment. We can see that starting in between March and April, there was a significant increase in folks enrolled in SNAP. It's about 70,000 or 60,000, excuse me, new SNAP cases in the state between that month, over that month. And then we can see that it continued to rise through July, reaching its high point in July, and then has decreased over the course of the next couple of months. However, at 500,000 Coloradans enrolled in SNAP, we're still much higher than we were back in February of 2020. It's about a 17% increase in SNAP enrollment over this period between February and November. Next slide. And when we look, at different regions of the state, we can see that not all experienced the same increase or rates of increase as others. So this chart here shows changes in enrollment by region. 100 on the chart is equivalent to that region's SNAP enrollment as of February 2020. And so subsequent months show sort of the percent changes relative for each region. We can see, the rural resort region, which includes the mountain resort communities in our state. So, Summit County, Pitkin County, Eagle County, counties in those parts of the state saw, over a 50% increase in SNAP enrollments between February and July. That's since declined significantly for that region, and is now about 25% above where it was in February of 2020. That was the highest region in terms of increase between February and November in the state. It's followed by the North Front Range and then the Pikes Peak region. So next slide. So we look at these regions geographically. We sort of get a better sense of just sort of where the impacts were felt most significantly in our state in terms of increasing food insecurity. It's not really too surprising to see that the mountain resort, rural resort regions, that's number 4 on the map, saw the greatest increase, since they were also the region that generally saw the highest increase in unemployment and the most job losses in the states. And so, I think due to sort of the tourism dependence of a lot of those counties and the closing of the ski resorts early at the beginning of last year, and that really had an impact on those economies that were felt much more strongly than places on the eastern part of the state, or even the southern or south central parts of the state. Next slide. However, that's not to say that just because a county saw or a region saw large increases in SNAP enrollment, that food security is as widespread as in that region than in others. We can see, in fact, while the mountain resort region actually saw the greatest increase in SNAP enrollment between February and November of this year, it still had one of the fewest, those enrolled in SNAP represented one of the smallest shares of, the population as a whole. in the state. So, around 4% of people who live in the mountain resort region were actually enrolled in SNAP, as opposed to, the regions in the southeast and south central parts of the state, where, it was closer to 25%, or 1 in 4 folks is enrolled in SNAP. And so while we have seen large increases in food insecurity in sort of the west rural resort part of the state and, some places along the North Front Range, in terms of, where food security is still the greatest issue in the state, it remains in the south and south central parts of the state. And with that, that's our last slide here. And so I'm going to open it up for some question and answers, and feel free to ask, direct your questions to Sarah or myself or both of us. And thank you for tuning in.
Yes, thank you, Charlie and Sarah. That was tremendous. Lot of information there, a lot to unpack. I'm sure there are going to be some questions. I already see 2 in the Q&A box. Q&A is at the bottom of your screen, just to the left of the chat. So I'll take them one at a time, and for other folks on the call, feel free to start adding your questions there, and we'll just go through them one by one. Okay, so the first question we have is from Bethany. She asks, it looks like the share of Coloradans receiving SNAP benefits has inched down a bit since May. Why would that be when food insecurity among lower income Coloradans seems to be increasing overall?
So I'm not sure. So in terms of the share of Coloradans receiving SNAP benefits, actually, I think it's gone down since its peak in July, but it's still, and I didn't do the math on this, so I'm not positive, but, I would imagine that it's actually, higher now, even though it's gone down a little bit, it's still higher than it was at the beginning of the year. And so, it could be that, if food insecurity is increasing among lower income Coloradans, but decreasing among SNAP clients, that could be an indication that, folks who are low income that would be eligible for SNAP aren't actually enrolled in the program. It also could just be if you're looking at the chart that showed, that was from the Census Pulse Survey, it could just be, that the sample size was really small for folks enrolled in SNAP that were responding to the survey. And so it's, an instance of where that data is not necessarily the most accurate. So that's a good question.
Well, and I think it's important also to remember that the number of people who are eligible for SNAP does not represent all of the people who are food insecure. There are people who are not eligible for SNAP for immigration status reasons, in which case they would lean more heavily on food banks and food pantries. There are people who might not be eligible for other reasons or just finding it difficult to keep up with the paperwork requirements, though I have to say that during the pandemic, our Department of Human Services has worked to make sure that there are fewer program requirements that people have to meet to get their benefits than there were previously. So, but yeah, it'd be good to know if we could get some other data on that. Perhaps Department of Human Services, if they're present, can get in touch with me. I would love to hear what they have to say, as I always do.
All right, great. Thank you for that answer, both of you. Next question is from Monica. She says there's a lot of concern about those under 60 and children, and that's definitely understandable, but she's curious about older adults, 60 and over, how they sit in these surveys as well in the future. She says they're seeing more and more older adults having to go back into communities for work because of a lack of funding for expenses and food, having to make decisions whether to pay utilities, rent, etc., versus food supply. So I don't know which one of you wants to speak to that. Sort of a question about the data, which Charlie might want to answer about adults over 60, and then sort of those impacts. So go ahead.
Yeah, so I didn't look at the impacts for older adults, but it is possible to break down the food security data that's provided through the household pulse survey by age groups. And so that would be one way to see how food insecurity has changed, or perhaps is a greater issue among older Coloradans. That's a good suggestion, something that we might be interested in doing ourselves, honestly, just to understand the issue a little bit better. But that pulse survey does provide breakdowns by age, and so that might be a good source of information Keeping in mind, again, the small sample sizes do make some of the data a little bit less reliable, I would say, than other data sources, but still, might be a good place to look for at least an initial sort of sense of how things have changed.
And one thing we've been thinking about at CCLP and talking about with our partners is how to get more SNAP benefits to older adults. There is an issue with qualifying for benefits because there aren't as many deductions taken from income when that income comes from pensions or Social Security. So, and that is true for folks who are experiencing disability as well. So there can be sort of a perverse impact in the program where people who need this nutrition are finding that they're not as eligible when their source of income shifts from one kind to another kind. And we've been thinking about ways in which to blunt the impact of that. I haven't talked much about legislation that we might be considering coming up for the new session, though we do have some things in mind, and some of which, if we go with them in this session, would benefit that group a little more than other groups. It's not quite formed enough to be able to talk about today, but I would say let's, if you want to keep tuning in, we may have some things that are aimed at that problem coming up.
Okay, good. So the next question is from Angel or Angel, and they ask, will there be another form of PEBT, the pandemic EBT, I believe?
Well, since I see Anya Rose from Hunger Free is in the chat, I would actually say she's the queen of PEBT, and I believe that we do have another round of PEBT coming up, the details of which I wouldn't know as well as she does. So if you folks would like to discuss, that would be great.
Okay, excellent. All right, next question is from Paul, and he's asking, is there any data on food insecurity for undocumented families?
So not that I'm aware of. I have to double check, but I'm fairly certain that they didn't break down responses to the pulse surveys by citizenship or nativity. They might have, so that might be one place to look. I don't remember seeing it, and I don't think that they did. But that would be my sort of first, guess as to where, you could go for a source of data on food insecurity for undocumented families. But I don't know if Sarah, if you're aware of others that might be useful as well.
I don't know. My guess has always been that food insecurity for undocumented families is higher simply because of the lack of access to programs like SNAP. And it's also harder to get that data given the reluctance of people in that community, the very justifiable reluctance to come forward and participate in surveys and make themselves known.
Good, okay. Next question is from Ashley. She says, you talked about enrollment. Do we have info on what rates of enrollees in 2020 are still using SNAP benefits? So if I'm just rephrase that a little bit, I think she's asking, folks who have enrolled in 2020, are they still using SNAP benefits, and to what extent?
That's another good question, and I'm not sure that that is tracked by CDHS. So it would be interesting to understand, folks who are on SNAP are able to, if the people that are on it now are largely the same people that were on it at the beginning of the year, or sort of how that has changed over the course of the year. But I'm not aware of any data sources that would tell us that.
CDHS does track the number of households that are on the program in any given month versus the number of unduplicated households that are in the program during the year. So, which is always a higher number. There's always going to be some people, churning on and off the program, but they do have a figure for the unduplicated number. And we couldn't necessarily completely track that back to certain enrollees, but they probably have an idea of the average number of months that people receive benefits. So I'm wondering if they have that data now for 2020. It would be, they often put stuff like that on their website. It'd be interesting to take a dive into that.
Mm-hmm. Yeah, that sounds really interesting. All All right, our next question is from Laura. Laura asks, have either of you seen any data, or you might know something anecdotally, that shares about the impact of closed restaurants on food insecurity? She says many of the shelters have been hit since they often had significant arrangements with different restaurants to complement how they provide meals to residents, and that sort of thing.
No, that's an interesting question, and I haven't seen any data on that. But you're absolutely right. I mean, I'm sure that I would venture to guess that the restaurant closures did have a tremendous impact, and particularly if they had arrangements to provide free meals to different homeless services or providers, service providers. But I have not seen anything specific about that, nationwide or in Colorado specifically.
I haven't either, though I know that anecdotally, some restaurants have made their facilities available to food banks and pantries for storage of perishable items. So they've been helping out in that way, providing freezer space. SNAP as a program doesn't cover hot food traditionally. That's one thing that we are thinking about, though, is whether we can get a waiver of that so that we can provide hot food to people, which would mean more people who don't have cooking facilities would be able to access food that they can actually use.
That seems like a really good idea. Okay, next question is from Natasha, and she says that I know the SNAP program has been traditionally under-enrolled. How does current enrollment compare to pre-pandemic enrollment? Is the current enrollment over budget at this time? Can previous savings from under-enrollment be used now? Those kind of three questions there, but the first one is about what increase in enrollment have we seen, and then the rest of it's about the budget, whether we're over budget and some of those savings or reserves can be deployed now.
Sarah, do you want to take that one?
Sure.
I don't know about how it's funded, so I think that.
So SNAP has been traditionally under-enrolled compared to the population of people who we know are eligible. I think at any given time, we only have about 60% of them enrolled in the program. So I think Charlie's data that he came up with for this presentation showed a 15% increase over that. And to what degree that's going to represent people who could have been enrolled before and happen to have searched out that assistance now, or whether these are people who are only going to be temporarily until the employment situation improves and they're only going to be on the program for a short period of time, is unknown. I wouldn't be surprised to see enrollment stabilize at a higher rate than before, but how much higher is hard to say. When we talk about the SNAP budget, SNAP is a federal program and the money for the benefits comes from the federal government. It's an entitlement program. So if people who are eligible get access to the program, then their benefits are paid for by the federal government. The part that the state pays for is the administration of the program, which, though significant, is not as large an amount as the money that we're able to pull into the state from the federal money. So we don't exactly have an idea of enrollment being over budget. It's just the more people who are on, the more federal money can come in. I think that CDHS has had its own staffing challenges with the increase, and that would require more state money to step up and, provide for more eligibility workers and help make system improvements to streamline enrollment. Those kinds of things do cost the state money. So there isn't really either, we aren't exactly over budget, and we don't really have a savings either, from under enrollment. It's just the more people we can get into the program, the more money we can get. And that's one of the things that makes it so valuable in addressing food insecurity.
All right, good, thank you. Another question from Angel or Angel. What sort of food security is available now for undocumented families?
The federal programs are pretty much off limits to undocumented families, which is something that we don't agree with and would like to see changed. I think An incoming Biden administration has already talked about removing the penalty, the public charge penalty for certain benefits. I would like to hear more about that from them. Other things that don't require federal money are available to undocumented families. So the food banks, the food pantries, community-run programs that don't have bars on that kind of enrollment are out there for those families.
I'll just note that Allison mentioned in the chat here that WIC is available for people.
That's right.
regardless
That's
of.
right. Thanks, Allison. WIC is available.
Good. Next question is from Shar. She asked, did the recent relief bill, the one that just passed days ago, probably passed by Congress, extend food aid, or have any of those programs actually ended with the end of the year?
It did extend some food aid, and I think it increased SNAP benefits by 15%. I'm not sure what happened yet to some of the emergency programs like Farms to Families. I think some of our own partners who are in the food pantries and food banks would know more about that. In the state, we've channeled some of the CARES Act funding, another $5 million to food banks and food pantries through the Food Pantry Assistance Grant. So that money is actually going to start flowing any day now because we opened up the application period and we just closed it and met last week just before the holiday to talk about, how to distribute those funds. So that's going to be getting out there.
Good. That's encouraging. All right. And then next question I have, which at the moment is the last question. How have healthcare providers been engaged in sharing information regarding PEBT? Many of our family physicians see patients experiencing food insecurity during this time, and I wonder where and how they can support folks in getting access to these life-saving benefits.
Yeah, that's a thing that Anya would know about. I know that in the CCLP is a member of the Blueprint to End Hunger, which is a coalition of anti-hunger organizations. And we have talked about ways to increase cross-program alignment. So right now we have healthcare providers who help people get involved with Medicaid. And we're trying to find ways, can they also reach out at the same time on food and hunger issues. It's actually more complicated than you would think to get them to do that. It's frustrating in that way, but especially because we believe, as I'm sure many of you do, that access to food is a healthcare issue and not just some kind of standalone issue. So, Anya, do you know if they've been involved with that? Healthcare providers and PEBT? It's been primarily the school districts, I think, that have been reaching out to families.
We'll see if she wants to answer that in the chat here in a second.
I'm sorry to offload my questions onto Anya, but
we might have to put her on camera next time.
I know,
we do right? Yeah, well, good questions, everybody. If anybody has a last question, pop it in there. Otherwise, that's the last one I have in front of us. And really appreciate all the great questions. That was tremendous. It sounds like we had some great information and some interesting things to look into for the future as well for our team. So really appreciate your participation in that and for joining us today. With no more questions, I'm going to wrap up and I'm just going to highlight our upcoming sessions for the rest of the day. So we're halfway through the legislative preview. Next session is at 2 o'clock. We're going to talk about health and healthcare. Our own Allison Neswood and special guest Kayla Frawley from Clayton Early Learning are going to be presenting there. And then at 4 o'clock, bringing up the end of the day, we've got our senior attorney, Jack Regenbogen, and Cecia Guadarrama Trejo from 9 to 5 Colorado. So both of those should be really fantastic presentations with CCLP staff and a valued partner. So we're really looking forward to that. We hope you can join us. So tune in here in a couple of hours and we will see you then. Thank you all. And thank you especially to Sarah and Charlie for all the presentation and the information. Really appreciate it.
Okay, thanks.
Thanks for tuning in.